A partial hospitalization program is an intermediate level of care between an inpatient and an outpatient service. Averaging 20 hours of treatment per week, it provides a very cost-effective option, both when someone is discharging from an inpatient level of care or if someone is in a regular outpatient care and they need to get a little bit more intensive treatment, but not to the point that requires an inpatient hospitalization. Recent study has shown the partial hospitalization program that offers more like a dialectical behavioral therapy model and a curriculum have shown more improvement. And what the data is showing, the DBT related program focusing on the improvement of emotional regulation and interpersonal effectiveness, they are more stronger predictive of symptom improvement and decreased length of stay. So it's important to understand, different level of care. The highest level of care is inpatient hospitalization, then a partial hospitalization, then intensive outpatient, and then a regular outpatient. Thank you.